You know how people always say babies change so fast? Well, it's true, but some things are happening right from the start that most of us don't even realize. Like, did you know that up to 1 in 250 babies are actually born with some degree of hip instability?
It's called congenital hip dislocation, or CDH for short.
CDH.
And yeah, it's way more common than you might think.
Okay, CDH. So for those of us who aren't doctors, what are we even talking about here?
So basically, with CDH, it's all about the hip joint
Okay.
and how well that ball at the top of the thigh bone, the femur,
Right.
fits into the hip socket.
Okay.
And with CDH, that fit, it's off.
Off how?
Well, it's a whole spectrum. It could be as minor as the hip just being a little loose.
Okay.
Or in more severe cases, the femur can be completely outside of that socket.
Wow. Completely outside the socket.
Yeah, it's surprising how much variation there can be.
That is wild. And you're telling me this is happening right from birth?
Yep, hence the congenital part.
Congenital. Right. Okay, so then how in the world do doctors even begin to diagnose this? I mean, we're talking about newborns here, tiny little things.
Right, and this is where those early checkups are so crucial.
Okay.
Because doctors have a couple of really clever tests they use, specifically for this.
Like what?
So you've probably heard of the Ortolani and Barlow tests.
They sound familiar, but honestly, I have no idea.
These sound like, I don't know, maybe fancy Italian cocktails.
Yeah, kind of, right.
Right. But they're actually these gentle but very specific ways of moving the baby's legs
Okay.
to feel for any clicks or pops in the hip joint, which can be a sign of CDH.
So they're literally feeling for that hip slipping in and out of place.
Exactly. And it can be really subtle, especially in a newborn. So that's why these tests are so important.
I bet. So those clicks and pops, that's the giveaway.
It's a big one, yeah. And the good news is, if it's caught early, in those first few months of life, treatment can often be pretty non-invasive.
Non-invasive, so we're not talking surgery here.
Not usually, no.
Yeah.
In these early stages, it's often about things like special harnesses or splints that help guide the hip joint into the proper position while the baby is growing.
So like a little support system, kind of gently encouraging those bones to develop correctly.
Exactly. I think I saw one study that called it dynamic splinting, which I think captures it. Well, it's not about forcing anything into place, but rather guiding that natural development.
That makes a lot more sense.
And there's this one harness in particular that comes up in the research a lot, the Pavlik harness.
Okay, the Pavlik harness. Tell me more.
It's actually pretty simple. Kind of like a soft pair of suspenders for their little hips.
Suspenders. Okay.
Yeah. And the key is it allows for some movement,
Yeah.
which is crucial for a baby's development. They got to wiggle.
Of course.
Right. But it keeps those hips gently positioned, so it's like encouraging them to grow the right way.
Like a gentle nudge in the right direction.
That's a great way to put it.
So we're working with those little bodies, not against them. I like that.
That's the goal with early intervention.
For sure. But what happens if it's not caught early? Those babies grew up so fast.
You're right. And as they become more mobile, things can get a bit more complicated, which is what we'll dive into after the break.
So before the break, we were talking about how things can get more complicated with CDH as babies become more mobile. Like, what kind of complications are we talking about here?
Well, for starters, the signs of CDH can be a little different once babies become toddlers.
Different how?
Well, with newborns, those clicks and pops during the Ortolani and Barlow tests, those are really key.
Right, right.
But as babies get older, doctors are also looking for things like differences in leg length.
Differences in leg length meaning?
One leg might look shorter than the other,
Okay.
which, again, not something you'd necessarily notice just from looking, but definitely something a doctor would catch during a checkup.
That makes sense.
And then there's limited range of motion in the hip, like if one leg doesn't move as freely as the other.
I see.
And then there's this thing called Galeazzi's sign.
Galeazzi's sign. Sounds serious.
It's just a visual cue, but it's one that parents can actually look for, too.
Oh, really? Like at home?
Yeah, so if you lay your baby on their back with their knees bent, feet flat on the surface,
Okay, I'm picturing it.
if one knee sits noticeably lower than the other, that can be a sign of a hip issue.
So uneven knees, basically.
Basically.
Another thing to add to the list. So we're talking about things that are harder to spot at home than just looking for a shorter leg or something.
Exactly, which is why those regular checkups are so important, even if you think everything is fine.
Because the earlier it's caught, the better. Right. We talk about those harnesses and splints, but I imagine it's not always that simple.
You're right, and this is where things can get a little more, well, intense.
Okay, how so?
The research mentions that by 18 months old, surgery often becomes the primary treatment option for CDH.
Wow, surgery. That feels like a big jump from a harness.
It is a big jump, and it highlights why catching it early is so crucial.
Because if it goes on that long, you're talking about a lot more than just a slightly loose joint.
Exactly. You've got a toddler running around, putting all their weight on a hip that's not properly aligned.
That can't be good for those growing bones.
It's not, and over time, it can lead to some pretty significant issues, which is why surgery might become necessary to correct that alignment and prevent, even more damage down the line.
Wow, it's amazing how much can change in just the first couple years of life.
It really is, but, it makes you wonder what causes this to happen in the first place.
That's what I was thinking. Is there like one main cause of CDH?
It's usually not just one thing. It's more like a perfect storm of different factors.
Like what?
Well, genetics definitely plays a role.
Genetics, meaning if it runs in the family?
Exactly. If a parent or a sibling has had CDH, the chances of a baby being born with it go up significantly.
Wow, so family history is something to be aware of.
Definitely. And it's a good reminder that family history isn't just about things like heart disease or diabetes. It can impact these musculoskeletal conditions too.
That's a really good point.
And then on top of genetics, there's also fetal positioning in the womb.
Okay, how does that play into it?
So babies who are in a breech position, meaning feet first instead of head down,
Right.
they have a higher likelihood of developing CDH.
Is there a reason for that?
It's not entirely clear, but some researchers believe it might have to do with how the baby's hips are positioned during those final weeks of pregnancy.
Interesting. So it's like the baby is kind of stuck in that position and it affects how the hip joint develops.
That's the general idea, and it's definitely something doctors are aware of and look out for.
Makes you really appreciate how every little thing during pregnancy can have an impact.
It really does. And, it doesn't stop there. Even things in the environment can play a role.
Wait, really? Environmental factors? Like what? This is blowing my mind.
This one might surprise you, but certain swaddling techniques have been linked to an increased risk of CDH.
Swaddling. I thought swaddling was like the go-to for soothing babies.
It can be, absolutely. Swaddling can be great for mimicking that feeling of being held, but here's the thing. If a baby is swaddled too tightly, especially with their legs held straight and close together,
Okay.
it can restrict the natural movement that's important for a healthy hip development.
So it's not just about finding the cutest baby blanket. We've got to be hip-conscious swaddlers now.
Exactly. It's all about finding that balance between providing that cozy, secure feeling while still allowing for those hips to move and groove.
Move and groove. I love it. This is all so fascinating. Who knew something as simple as swaddling could have such a big impact?
It really speaks to the interconnectedness of it all, doesn't it? Genetics, fetal positioning, and yes, even those early parenting practices.
And we're talking about potential long-term consequences here, right? Like, this isn't just about how a baby moves in those first few months.
You're right. It's about setting them up for a lifetime of healthy movement, which is what makes this whole conversation so important.
So we've covered a lot of ground here, but I'm really curious about those long-term consequences you mentioned. Like, if CDH goes undiagnosed or maybe even misdiagnosed, what kind of impact are we talking about?
Well, think about it. Going through life with hips that aren't quite right, it can affect everything.
Everything like what?
I mean, it's not just about, how a baby crawls or walks in those first few years.
Right.
It's about the potential for chronic pain, limited mobility, even an increased risk of arthritis later in life.
Arthritis. Wow, I hadn't even considered that.
It's a big one. And it really highlights the importance of catching and treating CDH early on.
Because it's not just about fixing the immediate problem, it's about preventing those bigger issues down the road.
Exactly. It's about setting them up for a lifetime of healthy movement.
I like that. A lifetime of healthy movement. That's what we want for all those little ones.
Absolutely. And while we can't go back in time, we can arm ourselves with knowledge.
Knowledge is power, right?
Exactly. And understanding the signs, being aware of the risk factors, it empowers parents to advocate for their children.
For sure, because those early checkups, they really can make all the difference.
They really can. And if something doesn't feel right, trust your instincts. Don't be afraid to ask questions. Get a second opinion. Be your child's advocate.
Be your child's advocate. I love that. Because sometimes those little ones, they can't advocate for themselves.
That's right. And who knows, early intervention could mean a lifetime of difference.
Absolutely. Well, this has been incredibly eye-opening. I'm definitely going to be looking at those adorable baby swaddles in a whole new light now.
That's what we like to hear.
Well, a huge thank you to our expert for taking us on this deep dive into CDH. And for our listeners, remember, you can find more information and resources linked in the show notes.
My pleasure. Always happy to talk about this important topic.
Until next time, keep those brains curious and those little ones healthy.